Good afternoon, everyone. We thank you for tuning in with us today. I know it's not our, we've been giving you COVID-19 updates every other Thursday, but Tribal Council and the Incident Management Team and the Health Department thought that because of the new uptake in cases, increase in cases in Arizona, Pima County, in our own communities, that we thought we should have one this week as well to give you some reminders and some good information. My name is Matus, and with us today we have two council members, Mrs. Buenamea and Mrs. Campoy. We also have Dr. Renteria, and we have Mrs. Larkins from the Health Department. I'll start off today with reading you some statistics to remind everybody where we're at. So in the Tucson area, from all our sources, and the report date is November 10th, 2020, we had a total of 642 positive cases from all sources, and we had confirmed deaths of 12. For the testing period from March 23rd, 2020 to November 10th, 2020, we had negative results of 5,705. Positive results were 343. Positive since last reporting period was 27. And recovered cases is 569. And from our Guadalupe community, reporting November 10th, 2020, our positive cases from all sources up in the valley are 813, and confirmed deaths are 18. And then from May 11th, 2020 to November 10th, 2020, we don't have anything for our negative results. We don't have that tally yet. And positive results was 201, and we don't have any numbers for our recovered cases. So that's it for our statistics. I would like to remind everybody to please, check all our media sources, from the radio station to Facebook to our Nixel mass messaging system to any of your emails that we have testing dates for November. I'm just going to go over them real quick. Thursday, November 12th, 9 to 5. Friday, November 13th, 9 to 5. And remember, on Fridays, we have the antibody test only on Fridays. Wednesday, November 18th, 9 to 5. Thursday, November 19th, 9 to 5. Friday, November 20th, 9 to 5. Monday, November 23rd, 9 to 5. And Tuesday, November 24th, 9 to 5. And during those testing dates, we also have the PCR nasal swab, the PCR saliva test, and now we have a new Binax card rapid test, and your results can be determined within 15 minutes. So, and this is at the Albert V. Garcia Auditorium. So please, if you feel any of you or your family members or co-workers need to be tested, please remind them of all those dates. And we'd like to see you all there for your testing. Next item we have would be, I want to remind everybody one more time that on your phone, you can text PYT Tribe to 888-777. One more time, I'll say that. Text PY Tribe to 888-777. And just opt in, and you can receive many of the messages that we push out to the community on your phones. That's all that I have for now. Council, would you like to say a few words?
Good afternoon. Buenas tardes. Dios te bendiga. My name is Mary Jane Buenamea. I'm a councilwoman, and I'm here just to tell everybody the importance of wearing a mask, hand washing and distancing when you can. And we're encouraging everybody, anywhere you go, especially the public, wear your mask. It's very important. And even in your family, encourage them when they go out to wear their mask. And the numbers are going up, like Mr. Matus said. And so we're trying to take care of everybody who's on the reservation, in our country, in our in the United States, and everybody is saying the same message, sending the same message to everybody. Please take care of yourselves. And this will pass one of these days, and we can go back to normal. But meantime, you have to refrain from parties, from going out, from drinking, from dances, from any leisure things that you do, and try to hold on a little bit longer. And we're all gonna be safe. We don't wanna lose anybody else. Thank you.
Thank you.
Good afternoon. I am Antonia Campoy, Tribal Council member, and I also want to say that please be safe out there. Like Mary Jane said, follow those social distances. And I know Thanksgiving is coming up soon, so we have to decide how we're going to be celebrating Thanksgiving. If it's just the immediate family, that's fine. Hopefully next year we can have our family gatherings again. But please stay safe, stay healthy, and especially our children, make sure that they're washing their hands and doing the social distances anywhere they go, whether they're going with you to the store. But I recommend that maybe they stay home and only one person go and do the shopping for food and those kinds. Keep them safe at home. Muchas gracias. Que Dios los bendiga.
Thank you. I'm interested. Buenas tardes. Good afternoon. Thank you for tuning in. This is Dr. Renteria, and today I have our interim director of our nursing department, Ms. Stephanie Larkins, and I want her to share with you some numbers because we are having also an increase of positives in the community. This has been happening now over the last week and a half or so, and this is new. We've been doing very well before that, so I wanted her just to share some information with you. Okay, Stephanie?
Hi, good afternoon. So in the past week, going back from 11/2 to November 10th, yesterday was a holiday, so we didn't test yesterday, but we have a total of 36 positives. 25 of those are from our testing site, and the rest are from other testing sites, like the Garcia Auditorium and hospitals, testing, LabCorp, and Norquest. What we do have here that Dr. Renteria just described is an uptick in positive cases not related to single households where we have whole families. We have a total of 27 new positives here at New Pascua, so this is a number we haven't seen here before, and they're scattered. It's scattered positives. So we don't have 10 from one household or 6 from another household. So that's concerning for us, and we kind of attribute all of that to schools being reopened, to the lax and just being done with the COVID-19, and people going out, starting shopping again, doing things that we weren't doing back in the beginning of this pandemic. So we have to remind everybody to please wear a mask, please wash your hands, social distance. The holidays are coming up, and this is going to be very difficult for everybody, not to be able to travel to see family. And the health department, Dr. Renteria, and the testing team have tried to figure out ways to make it so that there still can be some sort of Thanksgiving, some holidays, some Christmas, and so we're working on it on our end. So the smaller the better for the Thanksgiving. Immediate family members is the best. If you have to have people come in from, if you have family members traveling from other states, which happens for the Thanksgiving holiday, they're asking them to bring their own, their own plates, their forks, their spoons. It's just really crazy how this whole pandemic is going. So sleeping equipment like blankets and pillows. So we kind of asked to try to keep it as minimal as possible with immediate family members. There will be other Thanksgivings, and we want to just keep everybody as safe as possible. So we just have to try to work with what we have and try to keep everybody safe. The numbers here yesterday posted in the state of Arizona were 1,400 cases, but a couple days ago we were over 3,400 again, and that is a lot for us when we were down into the 400s and 500s in the whole state. So those are the numbers that I have, and I'll turn it back over to Dr. Renteria.
Thank you, Stephanie. So again, since we noticed that there has been an increase in cases here locally, the council wanted us to obviously have this meeting and to keep you updated as quickly as possible. As Stephanie mentioned, our spikes in the past have been more in families who had contact, and we were able to isolate that. But as she mentioned, these are scattered. And if you listen to the news media and people, the scientists that are looking at this morning I was listening to NPR, and they were interviewing an infectious disease specialist out of Wisconsin. And the data they have is that they definitely believe that these new cases are coming from two areas. One, family gatherings, and actually folks that are eating in restaurants that have now been opened. They actually, their data shows that if with family gatherings now, and if you eat in a restaurant indoors, there's a four times greater risk of getting the virus. Now, why is that? In the summer, when it was a little warmer here, we would be eating outside, barbecues and all that. It's not an enclosed space. The virus is still transmitted by the air in droplets. So it was easier for it to be dissipated and you had less contact with it. Indoors, it's just not possible for that virus to dissipate as fast as possible. So even if you're 6 feet apart and you're not wearing a mask because you're 6 feet apart and it's someone you know, a family member, the risk is still very high. And as Thanksgiving is coming, Harvest Day and Christmas coming, we all want to get together, and you might have, your Tío Jose you haven't seen in about 2 months, and the first thing you want to do is give him a hug. But you have no idea the contact he's had, and he may not know. So the worst thing you can do is that. I know it's really hard. And also being indoors, if anyone comes in who's asymptomatic and has the virus, then it's going to be in the air and it's real hard for it to go away. So what we're saying is try to keep your family gatherings to a minimum, right? And also, try to think of how you can creatively celebrate these holidays in a way that you can still have contact with family, but not in large groups. So again, I think now because it's also colder and we're doing more things indoors, that seems to be what's happening. Obviously, places like Wisconsin is a lot colder there, so they've seen this much faster than us because it's actually snowing there. But here it's been pretty cold, and people are gathering more together like that. So try to be really careful, and especially indoors, remember that the social distancing of 6 feet may not be enough. And if you have any guests whatsoever, you should all be wearing masks. And again, washing your hands as frequently as possible. So we'll keep an eye on this, and we'll keep you updated as the numbers go by, because I know when this COVID first started, we were very aggressive in July and August, and we did really well. At a certain point, I think we were the safest community in all of Tucson. The only other thing I want to mention is I want to remind people what quarantine means, because also as we've gone on and people feel a little bit better, quarantine means that you have to stay home if you were exposed to the virus or if you tested positive. It doesn't mean that even if you're at home, you can just run over to your neighbor and ask for a cup of sugar, even though you think, well, it's just, about not that far away. No, that means you stay home and you isolate. And we think some folks are just stretching the definition of that because they think it's okay, but it's not. So just be really, really careful. As our councilwomen said here, the bottom line of this is this tribe has just a little over 20,000 members. We've already lost a lot of folks that, we all know, and we do not want to lose anyone else, regardless of age, and obviously those that are highest risk. So that's why we're doing this. We just want to get through all this as safe as possible. So thank you for listening, and we'll keep you updated.
Thank you, Dr. Renteria. So as all of you can see, that everybody on this panel cares about your health. Everybody within our community should care about their own health and the health of their family members and their co-workers. So please remind each other, if you see someone that comes into a meeting or comes to your home without a mask, please remind them to put on their mask and keep their social distancing and be sure to wash your hands. And we're going to do our best to keep you informed, as Dr. Renteria said, every week of where our numbers and where we're at as a community. But please help us to help you. And we thank you very much for participating. I did want to add one more item and one more feature that you will see at this taping is that we have a new addition to our Facebook updates. A young lady by the name of Leti Moran. She will be providing sign language interpretation for you on our Facebook updates. And once again, I'd like to thank those folks behind the scenes, Mrs. Nunez and Mr. Angel Lopez, for all the hard work they do to put this together. So once again, we thank you and we'll see you next week. Thank you. Bye-bye.